Do you have a fear of surgery? It's actually called tomophobia. Most people feel some kind of nerves or anxiety going into any surgery. It's just kind of par for the course. It is totally normal. When the feelings go beyond just that simple nervousness, that normal nervousness, it can lead to surgical anxiety. The medical word for this type of anxiety, this level of anxiety, the fear of going under the knife, as I mentioned, is called tomophobia, which translates to fear of surgery. Of course, our weight loss surgery, our bariatric surgery, no matter what procedure it is, should not be taken lightly. But many people consider canceling it because of this overwhelming fear of surgery. Now, different patients fear different things about different surgeries. The more you know about where your fears stem from, the better off you'll be. The better you can prepare for them and plan ahead to relieve some of those fears and concerns. Now, there's different levels and different fear levels, anxiety, but typically the surgical anxiety fears include the following: death, pain, financial burdens, surgical results, secondary infections or illnesses, surgical mistakes, post-surgery scars, adverse lifestyle impact, post-surgical pain, the loss of mobility, the reduction of independence, disfigurement, low esteem, long recovery, being unable to wake up afterward, and of course, being awake during the surgery. Once you understand the types of fear and anxiety you are feeling, you are better able to address those fears in a constructive way. Stay on top of your essential information, like pre-surgery instructions and directions. A lot of the anxiety about upcoming surgery is because the pre-patients don't really understand post-surgery expectations or understand what is expected of them pre-surgery to prepare for the surgery. When you have anxiety and you're not prepared, it makes it difficult to understand, retain, and remember the information. So review that information constantly, consistently, every day if you have to, so that it's kind of planted in your head and that you remember. If you don't have those instructions, make sure you contact your surgeon or the surgical team and ask for those instructions. If after that you still have such a high level of anxiety that it's almost paralyzing you with fear, please seek professional treatment for pre-surgery anxiety before you have the surgery. And before it becomes even a bigger problem and provides even more greater risks. If left unchecked, if avoided, these surgical fears can develop into full-blown panic attacks. You might experience panic attacks if you allow yourself to just dwell on that anxiety about surgery without taking action against and addressing those fears and your concerns. But the most important thing you can do is understand it, learn how to control the anxiety so it doesn't have the opportunity to control you. The good news is surgical anxiety is temporary. You can take some practical steps to lessen your fear of surgery. Avoid smoking or eating in response to your anxiety or stress. Fully educate yourself about your surgery. Discuss your fears with your surgeon. What should you be looking for? What does he or she suggest regarding those fears? As mentioned, take care of those pre-surgery instructions. Consider counseling or therapy. Seek alternative therapies for anxiety or stress. Get support from family and friends. Join a support group before having surgery and continue attending and discussing after having surgery. Make a commitment to prepare your body for surgery. Keep a journal detailing all your fears. Write it out. Pet therapy can help many people. Make a post-op plan. Incorporate meditation, play soothing music. Ask the surgeon if you can have soothing music as you go under. Start early. Start with full on preparation. Educate yourself about the surgery, but about all those other skills that you're needed alongside the surgery. Trust your surgeon and the team. And if you don't, address it. As I said, and I truly believe preparation is key. Please check out my video, Are You Prepared for Weight Loss Surgery?